Dr. James Eudo, the Kapelebyong District Health Officer, says 646 residents are suffering from elephantiasis.
646 is about 5.2% of our population having this problem. Because Kapelebyong has a population of about 112,500 people.
According to the World Health Organization, the neglected tropical disease occurs when worms called filario parasites are transmitted to humans through mosquitoes.
So when someone gets those germs, it takes about 7 to 10 years for the disease to actually manifest. Those worms go and block the lymphatic drainage, and that's why when the drainage fails, and that's why you find the fluid accumulating in the limbs, the fluid accumulating in the scrotum. We call it hydrocele.
Out of the 646 cases reported in the district, 344 are suffering from hydrocele, a condition that affects only men. Swelling of the limbs, however, affects both men and women.
There are other causes of hydrocele other than what? Other than elephantiasis. But this is the biggest cause. Elephantiasis is actually the biggest cause of what? Of hydrocele. That's why you find in some regions in Uganda, you may hardly see an hydrocele. But regions like Teso here, where we have those worms circulating.
Elephantiasis has rendered many people unproductive. Those with swollen limbs struggle to walk and perform daily tasks, while others suffer discrimination due to misconceptions that the disease is linked to witchcraft. Several residents cannot afford treatment. However, with support from the government and development partners, the district is conducting surgeries, performing up to 10 hydrocele operations a day. Joseph Marks, a resident of Okoboy Parish in Kapelebyong Sub-County, is one of the beneficiaries. The 70-year-old recently underwent surgery at Kapelebyong Health Center to treat hydrocele caused by elephantiasis. He says before the surgery, he could not engage in productive work because of the unbearable pain.
Cut off completely, because when you try to handle it, you feel a waist pain, and even on the right place, plus the right hand side of my private body, you hear something making a lot of noise.
Measures such as insecticide-treated nets, indoor residue spraying or personal protection measures may help to protect people from the infection. Kapelebyong District still faces health system challenges, including staffing levels of 23%, which affect service delivery. Some sub-counties lack health facilities.
Previously, with the old structure, we had a staffing level of 56%. With now the adoption of the new structure, that has dropped to 23%.
The district does not have a hospital, forcing patients who are in need of specialized care to travel to Amuria Hospital in Amuria District.
The community is very poor. Affording referrals for specialized care is sometimes a challenge. But if we had a hospital here, it would attract specialists.
Nobert Atukunda, NTV News.